Oh.
Nice. Franklin here today. Franklin, what do you want to look at?
My left shoulder has been in a bit of pain for a few months.
Okay.
On and off, so.
When do you notice it? Like sleeping, working at the computer?
I'd say working at the computer. When I'm
Okay.
standing up, walking around at work, sitting down at work, those
Okay.
types of things.
And does it hurt when you turn your neck at all, or does it get tight?
It's sort of like a full range of motion sort of thing. So when it does hurt, it hurts any movement that I make.
Okay. Like when you bring your arms up to the, is there any, so
Yeah.
point to it.
I'd say right here.
Right in the back there?
Yeah.
All right, so turn this way a little bit. It's up in here?
Yeah.
Okay. Bring that arm down. Ooh, it's clicky too. Do you hear it click a little bit? Drop that arm down. So I'm going to grab and dig my finger into that spot for a minute, okay?
Okay.
I think it's right there, isn't it?
Yeah.
All right, so I have really good, strong fingers for this type of stuff you use. So this probably hurts, right?
Yeah. Yeah.
All right. So now I'm going to hold that as you lift your arm up, okay? So lift your arm up. And that should hurt. And bring it down again. And bring it up again. And bring it down.
Yeah.
And bring it up. And bring it down. Good. Now do it without me. How does it feel now?
It feels there.
Yeah, because
Yeah.
there's a huge spasm in there. So we're going to have to work on that a little bit. We're going to do it today.
Okay.
But I know where it is now.
Yeah.
Usually if I can find it, I know how to work on it.
Yeah.
With this type of stuff.
Okay.
I don't know. Like, that's not the same for brain surgery. So
Yeah.
It's not like I find something in your brain, I know how to work on it. But like musculoskeletal stuff, shoulders, back, necks, knees, feet, ankles, hips,
Mhm.
wrists. If I can figure out the spot, I can usually form a little bit of a game plan what to do. Okay. So we're going to look at that today. I'm also curious to see what your neck is doing when you turn, because I think that might be compounding, or it might be part of it.
Yeah.
So I want to see if there's a connection. I'm not sure yet, but I'll know in a minute.
Okay.
But I'm gonna have you lie face down, and I know that hurt when I dug my finger in, but you felt like it was on the spot, right?
Yeah.
And sometimes there is like a relief when someone can find the spot, you know, that you're just like, I just want them to understand that this is my spot. So
Exactly.
it's not that it's comforting because I dug my finger in there, but comforting to know that someone acknowledges that you did have a spot that needs work. And so that part has a certain sense of satisfaction. But guess what I felt? I felt like a wicked muscle knot in there. And I think that is what I need to help you with today. So drop your head down. And your legs are even, which is really nice. So now I'm going to bring your legs up to this position. And they're still even. I'm going to bring them past 90 degrees. Take a look again. And still even. So now I'm going to have you turn your face to the right. Drop your shoulders. Let your head rest there. And now the leg goes short. So I'm seeing the left leg pull short, probably a good centimeter, maybe 1.5 centimeters. Head back to center. And let's stay right on the feet. And now turn all the way to the left. So the left seemed to balance. Turn to the center and turn to the right. Okay. Do you feel more symptoms when you turn to the right or turn to the left?
I'd say right.
Okay. So that's what's showing up down here too.
Yeah.
So point to where you feel tension, tightness, restriction when you turn.
I'd say like right here.
Back into the spot that we started.
Yes.
So here's one right here. Do you feel that nasty spot?
Yeah.
So we're gonna work a little bit of we're gonna chase the pain for a minute, okay? And here's one I put my finger in before. And here's one here. Now turn your face to the right. It's gonna take a few of these, so I don't expect it all to do it on one pop.
Yeah.
But let me know if we're making progress. And if we're not, keep pointing out the spots. So now turn back to center. And as you turn to the right, think about where you're feeling a pull from. So turn to the right and help me out by touching it. Okay. Good flexibility, by the way. I noticed that. Okay, so right in there, right?
Yeah.
And there,
Oh, yeah.
and there. And you feel the tenderness of the spots, right?
Mm-hmm.
What does it feel like when I pop it?
It hurts, but also feels good.
Okay, it feels accurate, doesn't it?
Yes.
Like I'm on it.
Yeah.
So turn your face to the right. Did that change at all?
Yeah.
In what way?
It feels a little bit relieved, but still a bit tight in the same original area.
Okay, so let's do a little more with the shoulder. So now I'm going to have you turn your face to the left and leave your head there for a moment. And I'm going to have you squeeze your left elbow into the side of your body. So pull this in tight, which flares the shoulder blade. And then relax your elbow, and the leg went short. So I bring it up to position 2, and it actually lengthened. It got longer on that side. Head back to center. So we're going to adjust for a lateral scapula. So we're going to adjust the scapula from lateral to medial. I'm going to adjust the humerus from superior to inferior. I'm going to adjust the ulna. I'm going to adjust the carpals in 2 spots. I'm going to have you redo this now. Pull the elbow in, let it relax, go down to the feet. Check, they're balanced. It's nice, right? So now turn your face to the right. Let me know what it feels like now when you turn your head to the right.
Feels better.
How much better?
I'd say 50% better.
Okay, that's cool, right?
Yeah.
We've only been at it like 6 minutes, right? So let's do some other stuff. Lie face down again. Now I'm going to come in with my hand here, okay? Right in there.
Yeah.
I'm going to adjust into that spot. Big breath in. And blow it out. Good. And you felt that pop, right?
Mm-hmm.
Big breath in. And blow it out. That was a big one, right? Big breath in and blow it out. You hear those?
Yeah.
Good. So now crawl to the top of the table and drop your head down again. You still have this one though. Do you feel that one?
Yeah.
Really nasty right there.
Oh.
You hear all those pops?
Yeah.
Good. I'm going to pull this paper away for a minute, okay? So now I'm going to do this side. And then let me take the head. So you just let the head be there.
Oh.
Nice. Now turn your face to the right. See if we're getting closer.
Oh, yeah.
If
Yeah,
you were
that's-
50% before, what are you now?
I'd say about 80%.
80%.
Oh,
Okay.
yeah.
I'm pretty happy with 80%, but we got a little more to do, okay?
Okay.
So lie on your back, please. I'm gonna come up high because I feel like you got some under the skull here. Do you feel this one?
Yes.
So my finger is right at the atlanto-occipital joint where the occiput meets the atlas. And I'm really high up in here. Okay. So tuck the chin down just a little bit and then let it roll up. Good. And drop the head here. Good. Now I'm going to have you lie on your side facing me this way, please. Actually, I need you close to the edge. And pull the top knee up. And this tucks like this. I'm going to take your wrist, pull this out this way, and bring this arm down, hip down. Got it. Lie on your back. I'm going to adjust a little bit into the humerus that I saw before. Right in there. Do you feel that nasty spot?
Yeah.
So I'm at the head of the humerus. I'm going to adjust it from anterior to posterior and slightly inferior to superior. Now come stand. And move that shoulder again now.
Oh, yeah, that feels better.
Okay.
A lot better.
Good, it's a good start, right?
Yeah, yeah.
Now you might want to come back, but
Yes.
if you don't, it's still going to just keep healing now.
Yeah, no, that
Yeah.
definitely feels a lot better. I
So
appreciate it.
thanks
Yeah.
for coming in and
Yeah,
trying
of
this.
course. Thank-